Good afternoon. It's a great pleasure to be joining you to give this input that will be focusing on the challenges of implementing evidence-based research in different research environments. I'm Taryn Young, and I'm based at Stellenbosch University in Cape Town, South Africa. I am a public health specialist by background who has been active in the field of systematic reviews and conducting systematic reviews for a number of years. I'm a strong proponent of evidence-informed practices with a passion for building capacity in this area, and I'm also an advocate for equitable, transdisciplinary and intersectoral approaches. I'm involved with a number of projects, both within South Africa, within the region and internationally. I highlight some of those by adding their logos on the slide. And I just want to upfront state that the presentation that I'm giving is drawing on my experience of working in this area. And I'm not necessarily expressing the views of the funders of the projects that I'm noting. So conducting any research project is a journey, and the research environment that we work within is underpinned by a culture of integrity, and it's based on good governance, best practice, and support for developing researchers. We need this environment to be enabling and effective, and it typically includes clear policies, practices, and procedures to support researchers, suitable learning, mentoring, and training opportunities, having rigorous and robust management systems to ensure that the policies are being implemented, and awareness needs to be created among researchers of the various standards and behaviors that's expected of them. And then it needs to have systems in place for identifying potential concerns early on and having mechanisms and ways to address and support those who's been affected by these concerns that's been identified. Now, in the research environment, there are many different actors. It spans from the research team to the department within which they are working, to the institution that has its own institutional culture, strategy, policies, and procedures. Then there's the journals, the funders, national bodies, as well as international bodies, regulators, and with various principles. Ultimately, the research environment needs to support behavior and practices that are expected of world-leading and world-class research environments and support robust and relevant research. But we've seen quite a concerning trend in research as it links to waste or avoidable waste in research. In 2014, The Lancet published a series looking at avoidable waste, or what they also refer to as inefficiency in biomedical research. And this figure illustrates the 5 key areas that they highlight where waste can be avoided in research, starting with ensuring that the research decision for the question that the research is going to be done on to be informed by existing research. And they phrase the question as, are research decisions based on questions relevant to the users of research? Secondly, when research is being done, is good methods being used to do those studies? Thirdly, are there efficient research regulation and management systems? Are the research being published and put out in the public domain? And also, when it is being published, Is it unbiased and full reporting of what was planned and what was found in the research? Now, evidence-based research is being put forward as a mechanism for addressing this research waste, where when research teams are considering new research that they would like to conduct, this evidence-based research approach will advocate for systematic and transparent approaches to be used to explicitly look at earlier studies and also consider the use of end-user perspectives to be able to inform questions for new research and to ensure that it is evidence-based. Now, 2020 was a year that is going down in history. We are all affected in many different ways by the COVID pandemic. The graph that you see on the left-hand side is when cases were just starting in 2020 in January. And what you see on the right-hand side is what we see now in September 2021, where worldwide we have more than 225 million cases, people that have been infected by the coronavirus. And this has generated many questions that managers and healthcare practitioners are grappling with. Questions linked to public health measures, to clinical management, to health system arrangements, and to economic and social responses. So what did this do for research in this area? Before the pandemic, it was estimated that already a huge amount of research was being wasted, and wasted because of poor questions, or not being done well in terms of study design, or not being reported, poorly reported, or not reported at all. Glasio et al. Has put forward that these problems in terms of research waste has been amplified by the pandemic, because now with the time pressures and inadequate research infrastructure and the fact that everybody is looking for answers, there's actually been more poor quality research being done. Looking at the WHO database on COVID studies, there are more than 340,000 records within the WHO database. So this is a real problem that needs to be addressed. So in this talk, I will cover some challenges linked to implementing evidence-based research practices. And I'll be using this framework by Robertson and colleagues from published in 2020, where they put forward that before the conduct of your study, evidence-based research approaches needs to be used to ensure that the research that's being initiated, the questions that's being asked are justified. And then when you conduct your study, when you completed the conduct of the study, you then still need to put the results of that study within the context of what is known already, and then conclude with implications for practice and implications for research. So starting with the beginning, where we start by identifying our research questions, there have been many research priority processes, priority setting processes that's been put forward. Many different strategies used to assist researchers and policymakers in effectively targeting and identifying research that has the biggest benefit in terms of how it's been done. This review that was published in Health Research Policy and Systems is a review that looked at various checklists for health research priority setting. And some of the common themes that came out of these various approaches is that it comes down to engagement between researchers and decision makers or the end users by working collaboratively, inclusively, being transparent about the whole process, drawing on existing research to inform what is being done, and also avoiding unnecessary duplication. Some challenges in doing this in practice, in getting end user perspectives, speaks firstly to research teams having access to these end users. Some have this access and they can phone a friend or drop an email to find out what the issues are within the clinic or within the policy world at that particular time. But many researchers do not have the access. They also feel that they're not capacitated to actually do that engagement. Rarely do we see research capacity building initiatives, including aspects of how to engage with end users and how to find out from them what the issues are. The bottom line with having this engagement speaks to building and maintaining relationships, which also links to building trust. And these all speaks to one of the key first steps in implementing knowledge translation initiatives. Furthermore, to be able to successfully do and get end users' perspectives, you need to have the necessary resources and time to engage. And in many cases, the resources speaks to ways of being able to secure time of key personnel. If we move on to using existing systematic reviews and to be able to combine that with the input from end users to then consider whether the proposed research is being justified, I still turn to this quote from Egger from 20 years ago, where he put forward, two processes are at work side by side: the reception of new material and the digestion and assimilation of old material. So ultimately, what we would want researchers to be doing is that as they think through what needs to be done, they need to identify and use systematic reviews to inform the planning of new studies. And in some cases, if they find out-of-date reviews or they don't find any reviews, they may have to conduct systematic reviews. So this sounds very obvious to me and very rational, but how often do we read a protocol for a research study and there's no reference to an attempt to finding existing systematic reviews? Or you look at the justification for new research for a postgraduate student, and you see that there's also no systematic process of trying to identify existing systematic reviews, and they often just use subjective mechanisms to write the rationale for their studies. So is it that the researchers do not know about using systematic reviews, or is it about them knowing but just not wanting to do it? A question that I still would like to answer. There has been a huge growth in the number of systematic reviews. And over and above the increase in the volume of systematic reviews that's available, the methodological quality of these reviews are also a challenge. Here, I'm showcasing one example of work that I was involved with in last year, where in response to the pandemic, we were asked to inform and give information on how to manage COVID in persons with non-communicable diseases. Some questions that were posed, such as is there increased risk of severe COVID, as well as hospitalization in death in COVID patients with these NCDs? How can one screen patients with these NCDs? Also looking at management and prognostic markers. And they, in our search, we decided to look for existing systematic reviews, and we identified 44 systematic reviews that were done between October 2019 and June 2020. And 44 in this very short period of time. About half of these were preprint, so they were not yet peer-reviewed. And on applying the AMSTAR tool to look at the methodological quality, we found many shortcomings in terms of the methods, which just highlighted that for those who are planning to use systematic reviews, you first need to appraise the quality before you look at the results. And you cannot just pick up the review and only use the results without doing any form of quality appraisal. Many research teams, so it's not just decision makers that one often referred to as not knowing how to find and read the reviews, but many researchers lack the knowledge and skills and resources to find, appraise, and interpret systematic reviews. From the knowledge and skills to know where to search and how to search, to having access to the internet and access to relevant databases. And when you find existing reviews, having access to full text articles. When it comes to critical appraisal, you do need the knowledge and skills to be able to make sense of the methods of the systematic review by applying tools like the AMSTAR tool, then to interpret the results of the review, and to go on and consider the applicability of the findings. If we turn to the research environment and the systems that's in place at the institutional level, one often finds that there's lack of systems to audit the use of systematic reviews, that, especially the use in informing new research. If you consider useful places where this can be done, it can be, for instance, with guidelines for postgraduate students. All of their protocols need to be reviewed and approved by postgraduate committees. Primary research protocols needs to be reviewed by ethics committee, a perfect place to look at the rationale and ask and prompt whether has this research been informed by a gap in the knowledge as identified by reading existing systematic reviews. And similarly, research funders also have a key role to play, and they often don't do this in terms of asking for whether research that's being supported has clearly been justified. So if we move on from challenges linked to using systematic reviews to challenges related to doing systematic reviews, and you can see if we look back at the framework proposed by Robertson and colleagues, is that these steps around doing a review may come in before the conduct of the study, if it is that you find no existing systematic reviews, or it may come in after the conduct of the study, where you may have to update an existing systematic review. The key strategy or the key issue of importance is that when you're conducting a systematic review, you must follow steps to minimize bias and to ensure that the review that you are producing is of high methodological quality, representing the totality of the evidence for the question that you're posing. Now, there are many challenges linked to doing systematic reviews, starting with the unnecessary duplication of reviews, which is not something new. In 2013, this publication in BMJ highlighted the problem with duplicate systematic reviews and saying that the best way to reduce unnecessary duplication of systematic reviews may be to make it compulsory for systematic reviewers to identify existing reviews, whether it's a protocol or a completed review, before conducting their own. And this could form the first step of the review process. This was published and put forward 8 years ago. So I'm not saying you shouldn't do a review on the same question, because some replication is important, but it's the unnecessary duplication that is wasteful. If we turn to some of the COVID examples, if we look at Prospero, which, as you know, accepts registrations for systematic reviews, rapid reviews, as well as umbrella reviews, on the 12th of September this year, more than 5,000 registered records of COVID-19 reviews can be found on Prospero. And they have this note on Prospero, and I quote, "Before registering a new systematic review, check Prospero and the resources on COVID-End to see whether a similar review already exists. And if so, please do not duplicate without good reason. Your efforts may be much more useful if switched to a different topic. This will avoid research waste and contribute more effectively to tackling the pandemic." The resources that they refer to linked to COVID-End as resources that I was privileged to be involved in to package with my co-chair of the synthesizing working group, David Tovey, and we package resources for being able to find and appraise systematic reviews, as well as for doing systematic reviews. And this is the flow diagram. And just starting with the top red boxes, it starts off by firstly wanting to determine if there's a need for a review. You need to clarify the issue or the decision that needs to be informed, and then to avoid efforts, identify and appraise existing reviews for currency, credibility, and comprehensiveness. And linked to these steps, there are resources available on this website for finding reviews, for appraising reviews, and also for identifying ongoing evidence syntheses. Then, if you should find a current, credible, and comprehensive review, you then use that review to inform your decisions. If it is that you find an existing review, but it's not current, you need to consider updating that review. And if you are not part of that author team, that is where you can contact the authors and see if you can be part of the team for that's busy updating the review linked to the need that you have. And if it is that you find an existing review, but it's not credible or it's not comprehensive, this is where you can consider replication and have good reasons for moving forward and doing another review on the same question. And then where you find no existing review, that would be the clear indication for doing a new review. And again, on this website, there's a package of useful resources for doing a systematic review. So linked to the challenge of doing a review and not doing it well, there are issues linked to author teams embarking on reviews, but not having the necessary knowledge and skills for conducting systematic reviews. The field of doing evidence synthesis and the various methods that's being employed is developing constantly. So as research teams, you need to stay abreast of all of these developments, which means it's a continuous cycle of training and capacity building. Furthermore, other issues that comes up in doing reviews is a lack of collaboration and teamwork, because being in a team and being able to work as a team is at the heart of producing a good quality systematic review. And then something to say about updating an existing systematic review. Some may think it's a quick fix, but as the methods evolve, in most cases, when you start with the update of a systematic review, you in essence starting with a brand new systematic review. Time and resources is another constraint and challenge for those conducting systematic reviews. Decision makers wanted the answer yesterday. And in the process of trying to answer or provide the answer as quickly as possible, often there's shortcuts which influence and impacts on the quality. Key to being able to deliver a review well would be active project management, having dedicated resources to support the conduct of these reviews, and having access to useful tools to streamline the review conduct. And then there's also research integrity concerns. Now, when we refer to research integrity, this is where we refer to being able to perform research objectively, with independence, openness, duty, and fairness in the methods that you're using. And you need to be able to give credit where credit is due. Anke Rowe, as part of a work that she's done on research integrity and research reporting, did surveys amongst authors, researchers in low and middle income countries to find out a bit more around the occurrence of poor research reporting practices. And she found that there was concerns about widespread guest authorship. Furthermore, she also found that conflicts of interest were poorly understood and often not declared, and also that the desire for academic status and power, research and organizational culture, and institutional systems that's linked to promotions are some of the drivers of these poor practices in low and middle income countries. One of the quotes which says a lot is where somebody put forward, so what they care about is not the research, but the publication. And this speaks to this drive within, especially academic institutions and research institutions, where it's all about the number of publications that you have produced in a particular period of time. The publish or perish culture, which is not working in the favor of evidence-based research. So in summary, I've been highlighting many challenges, challenges that influence the use of systematic reviews, And I've highlighted issues linked to the huge number of existing systematic reviews, the varying methodological rigor with which reviews have been done, which means you need to critically engage with the reviews to make sense of it. However, there's a lack of knowledge and skills amongst researchers to find, appraise, interpret, and consider applicability of existing systematic reviews. Researchers in some parts of the world struggle with access to databases, access to the internet, access to full-text articles. And I do feel that there's also a resistance in some cases to using systematic reviews, or to always feeling that one need to be doing a new review instead of using a systematic review that has been done somewhere else. And we lack systems in place at the start, at the point where research teams are still considering the question and the methods that they're going to be using, to prompt them and to remind them to use systematic reviews to inform their decision making. And then in the cases where it makes sense to conduct a new systematic review, we find that there's a big issue with unnecessary duplication, and the need to carefully consider questions for new systematic reviews, the need to follow robust methods, and then doing transparent and comprehensive reporting of that systematic review, and then also teams grappling with inadequate time and resources and inadequate training opportunities. And then there are also research integrity concerns. And these challenges are challenges that I do feel are similar across different research environments. And it's not the case of this being focused only within certain settings. So in conclusion, I've been highlighting many challenges, and I wanted to end off with some thoughts from my side on practical strategies for sustainable capacity strengthening for evidence-based research. And for me, it starts with advocacy. Advocacy to promote evidence-based research approaches, to highlight the issues, and to highlight the need for addressing it. We need to continuously promote the use of existing systematic reviews before doing a new one. We need to embed training for being able to find, interpret, appraise, and use systematic reviews for everyone, for all, not all researchers. And I think the best place to start is at the undergraduate level. Furthermore, you can have more advanced courses linked to doing reviews, and that can be at the postgraduate level. Because if we want to promote the use of systematic reviews, we have some responsibility to ensure that those doing reviews need to be doing them well. We need to empower senior researchers to be leaders and to be role models, to lead by example. It will be key to foster partnerships so that resources, drivers, and priorities are being aligned. And instead of rewarding multiple publications, we should be rewarding and have systems in place in institutions for rewards for avoiding waste in research. We need some proactive systems to address the issues that's been identified and to monitor and evaluate how things are going to address the big issue. Over and above all of this, we need to keep each other accountable. Thank you for this opportunity to share my thoughts and views on this very important issue.